Hello, my name is Brandy Steck and I am with Siouxland Community Health Center. I am here as the chair of the STI Coalition, which is part of the Community Health Improvement Plan to talk about STIs. A lot of people might know STDs, sexually transmitted diseases, and some people refer to them as STIs, sexually transmitted infections. The two are really interchangeable. They basically mean the same thing. The difference between STIs versus STD is the disease and the infection. Medically speaking, if you have a disease, you have some kind of symptom. You might have a fever or a rash or a sore. There are symptoms that let you know that you have that disease. With an infection, it's likely that you have no symptoms whatsoever. So throughout this presentation, I'm going to refer to them as sexually transmitted infections because of the fact that a lot of sexually transmitted infections have no symptoms whatsoever. They are asymptomatic, which is why it is so important for people to be tested, because if you don't have symptoms, you don't know that you have that infection. If you don't know you have the infection, you don't get treated, and therefore you are at risk of passing that infection on to others. But like I said, they are interchangeable, so STDs or STIs. Today, we're going to talk about national rates and also local rates. So nationally, between 2015 and 2019, gonorrhea cases increased more than 50% nationally, and syphilis increased more than 279%. Less than 20 years ago, gonorrhea rates in the US were at historical lows, and syphilis was basically non-existent, close to elimination. Advances in chlamydia diagnosis had made it very easy to detect, and STI rates were at historical lows. That progress has since been lost. We are at 6th consecutive year of record-breaking STD cases in the United States. In 2019 alone, there were nearly 2,000 cases of congenital syphilis reported, that's nationally, and 128 deaths from syphilis nationally. In 2021, sorry, I'm getting my dates confused. In 2021, there were 11 congenital syphilis cases in the state of Iowa. That is more than the past 4 years combined. And in 2021, South Dakota data shows over a 700% increase in syphilis rates, with 874 reported cases and 16 reported congenital cases in the state of South Dakota. Currently, Northwest Iowa is having a significant increase in syphilis cases in a relatively short period of time. In 2019, over half of the reported cases of sexually transmitted infections were among youth aged 15 to 24. Social inequality has led to health inequality and ultimately manifests in health disparities. In 2019, racial and ethnic minorities had STI rates several times higher than whites. And like I said, youth aged 15 to 24 had over half of the reported STI cases. The number of chlamydia cases per year has increased by 2,000 cases since 2011 in the state of Iowa. And in 2019, the state of Iowa reported over 16,000 cases of chlamydia and over 5,000 cases of gonorrhea. Like I said at the beginning, this is a record-breaking year for STI rates, 6th consecutive year. As you can see on that graph, from 2014 to 2019, rates of sexually transmitted infections have just increased. This is one of the reasons why the Healthy Siouxland Initiative has chosen STIs as a focus area for the Health Improvement Plan. Two of the initiatives for the STI Coalition are promoting the principles of universal 3-site testing and taking a complete sexual risk history when working with patients. It's also important to have a proactive protocol for screening for sexually transmitted infections and for treating sexually transmitted infections. This includes partner notification and partner treatment. If partners aren't tested and treated, the risk of that person being reinfected by their partner is very large. Another promotion that we're working on are ad campaigns and media campaigns directed specifically at adolescents and youth aged 15 to 24 so that we can educate adolescents and youth on the importance of getting tested and the importance of getting treated. Thank you for listening to my presentation. If you have any questions about STI rates nationally or on a state level, I encourage you to go to the CDC website. They have tons of great information, maps, and data points that you can find more information about STIs in your area. Thank you.